About 6.2 million adults in the US are currently living with heart failure, a serious disease that can have a dramatic impact on quality of life. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. February is American Heart Month, and we're focusing on your heart health all month long. I'm joined today by nurse practitioner Shana Durker with Blessing Heart and Vascular to talk more about heart failure. Shana, can you take a moment just to introduce yourself?
Absolutely. My name is Shanna Durker, and I've been working with Blessing since 2009. I've been currently in this role within Blessing Cardiology for about 6 years, 6.5 years, and I currently work with the Heart Failure Clinic as well as our electrophysiologist, Dr. Hammock.
Okay, well, thank you so much for joining us today. As I mentioned, we're talking about heart failure. So let's start with some really basic information. What is heart failure?
So, heart failure, there's a lot of mixed information out there, and people get really overwhelmed when they start searching the internet about it. Heart failure is broken down into simple components that your heart currently isn't functioning or pumping as efficiently as it should.
Okay, so maybe don't Google because you're going to get a lot of information. But just know that it is serious and that you
Yeah.
probably should see a doctor about it. But maybe not Dr. Google. So, when it comes to conditions of the heart, there is a tendency to think about the very pronounced or obvious symptoms. We're thinking about like chest pain and those kind of things. But with heart failure, I understand that like the early symptoms might be much more subtle. Can you talk a little bit about those early indicators and then maybe some additional symptoms that people might experience with heart failure?
Absolutely. So, heart failure can actually be very subtle, as you say. Some people don't actually recognize them as symptoms early on. They can be as simple as being more tired, waking up at night, having to go to the bathroom more at night, swelling in their legs, being more short of breath, even dizzy with activity, bloating in the abdomen. A lot of those are very vague and it's hard to capture, especially if it happens gradually over time. We With those symptoms, it can also show up on lab work that your primary care might run as far as screening labs. So we have to kind of collectively look at those symptoms over time and know what is your normal and base it off of that. But it can be hard for the patient to actually pick up on that quickly.
And just listening to some of the symptoms you listed, some people might just think, "Oh, I'm just getting older," but that might not be the case.
Right. So I always have to try to tell patients it might be your age, but did this happen within the past year drastically or 6 months? Obviously, you didn't age that fast. So trying to put it in a measurable perspective for them actually helps.
Okay, well, great information now. I know there are different types of heart failure. So, are symptoms different, or are they the same? Does it matter based on the specific diagnosis?
There are all different kinds of heart failure out there. There are different symptoms based off of the different types. Some patients are more apt to swell in their legs. Some are actually more apt to retain fluid in their lungs or their abdomen. Some are more apt to have lung related issues with the heart failure, whereas some are more likely to have kidney disease with it. So it really just depends on the type of heart failure that you have for different things that we're going to monitor or watch for. So I always get the questions from patients, well, my friend or family member has this and they're on these meds and this is what they're watching. You can't globally group everybody into the same basket. They have to really be broken down by type and all the different health factors that they have going on.
And so, knowing that there's so many different types of heart failure, different body systems and ways that a person can be affected by the condition, what options does a person have once they have heart failure, or how is the condition managed?
So there's all different ways that we manage this. Most commonly with lifestyle changes. So we actually teach the patient things to watch for. What are abnormal signs at home? What can they do as far as diet, exercise, daily vitals, those sorts of things, and when to be concerned. Then we move on to medications. What types of medications we use for different things and why we're using them. We then move on in some cases that a patient may need surgery, such as, device therapy that Dr. Hammock places or ablation therapy. Um, and then ultimately, we do have some patients who move on to advanced heart failure where we refer them to like Barnes WashU, and we talk about implantable mechanical pumps and heart transplants, that sort of thing. So there's all different things that we can actually do as far as treatment that helps the patient live successfully with heart failure.
So even though it can be a very serious condition, it is manageable.
Absolutely 100%. There are a lot of our patients who come in and they have a preconceived notion that, congestive heart failure, especially that word failure, that they are on limited time, they're discouraged. And once they meet with us and we actually teach them how to manage it and things to watch for, they actually learn that they can successfully live with this for a long period of time.
And on the subject of management, in 2020, Blessing started its heart failure clinic. You mentioned that you are instrumental in that clinic when we were introducing ourselves earlier. Can you tell me a little bit about the heart failure clinic? Who's it for, and how can it benefit patients?
So the heart failure clinic is for anyone actually that has heart failure. So it can be someone who was recently hospitalized, somebody who has a history of heart failure, somebody who was just diagnosed by their primary care or is questioning if they have heart failure. This can show up on a variety of tests that they can actually monitor for. So we get referrals from all different avenues. So it's really for anyone. And we teach them how to successfully live with the heart failure. They get resources that they wouldn't normally get, such as scales, blood pressure cuffs, care management. It depends. We really try to break down what is the socioeconomic factors that's contributing to their health condition. It's more of a one-on-one relationship and helping them treat their current condition.
And so ultimately, people could expect very personalized care
Yes.
with probably the goal of keeping them out of the hospital and living their highest quality of life. Is that correct?
Absolutely. Our goal is to keep them out of the hospital. We have a lot of interventions that we can do before they end up in the hospital. We can even do medications in the office to try to help that scenario. So we have a lot of tools in our basket that we can utilize.
It sounds like a really good option for patients who are living with the condition of heart failure. Is there anything else that you would like to add today about heart failure or the work that you're doing with the Heart Failure Clinic?
I would like to add that patients who are questioning the diagnosis or they're not certain if they need that level of care, the sooner that you seek help and those resources, the better. So if you're questioning it, then have that conversation with your cardiologist or your primary care. Just because you get involved with the Heart Failure Clinic doesn't mean that we replace those providers. We're just adding to your team so you can be more successful. So if you're questioning that or you think it might be for you, reach out. We'd be happy to see you and help give those tools to you.
Well, thank you so much for joining us today. There was a lot of great information for patients, for anybody, and maybe just a reminder that don't assume that your symptoms are just related to aging. Always having that conversation with your doctor, and knowing what your normal is.
100%.
All right. Well, thank you for joining us today, and you can find more information on heart failure and Blessings Heart Failure Clinic on our website, blessinghealth.org/heartfailure. Thank you again for joining me.
Thank you.